I'm not anti-vax. I get the flu vaccines. This one just feels a little different to me. You spend your whole pregnancy doing everything that you can to protect the baby. You can't change cat litter. You can't eat lunch meat. So injecting all these chemicals into your body is a little scary.
CDC data shows fewer than a third of all pregnant women in the United States are fully vaccinated. Dr. Manisha Gandhi is with us now, Chief of Maternal-Fetal Medicine at Texas Children's Hospital. Doctor, thanks. You've treated pregnant women with COVID. What kind of risks do they face? What are you seeing?
Thanks, Shep. We're just seeing a lot more sicker moms. They're being admitted to the intensive care units. They're having longer admissions in the hospital. They're developing respiratory failure, being placed on a mechanical ventilator. And then we're also having to deliver them prematurely. So they themselves are dealing with complications, but then we have to deliver their baby to improve their health. And that results in the baby having to go to their own intensive care unit.
Doctor, it took the CDC 8 months to strongly recommend the vaccine for pregnant women. Before then, they said it was just okay to get the shot. That delay, did it have an impact on low vaccination rates?
I think at the beginning it may have initially, but I think they were also trying to do their due diligence. Just like Stephanie mentioned, this feels different, but now women can be reassured that there's over 9 months of data that really shows this vaccine to be safe in thousands of women with pregnancies. So although I can understand, if anything, this should really help support women that this is a safe vaccine and they really can be sure that there's nothing being any kind of adverse events to be expected.
Doctor, when an expecting mother comes to you and wants advice and some clarity about the vaccine, what do you tell her?
So I tell her, just like Stephanie mentioned, all the things that you do to protect your baby, this is one of them. This vaccine will not only protect you, but it protects your baby by preventing you from getting sick, preventing a premature delivery, and then also transmitting those antibodies across the placenta that could protect your baby. So to people who worry about putting things in their body, once you get COVID and you're getting really sick, I have to give a lot more medications that have a lot less safety data than this vaccine.
Doctor, in the big picture, the numbers are going down right now, which is fantastic. When you look ahead to the winter, do you think this gets worse, or have we seen the worst already?
That's the million-dollar question. I was really optimistic in the summer when things were dropping down and just really feeling like we were maybe getting ahead of this finally. And then to be dealing with this surge and taking care of really sick women has just really taken a toll, such that even now I like hearing what you said about the numbers, but I'm still really afraid this is just another lull before another potential surge.
I sure hope not. Dr. Manisha Gandhi,
Great.
It's good of you to be here. Thank you.